Dr. Marcus Reed had seen it all in 23 years at St. Catherine's Hospital. Or so he thought. When the gunshot victim rolled into his ER at 2:17 a.m., Reed took one look at the chart and shook his head. Massive abdominal trauma. Shrapnel patterns consistent with military ordnance, blood pressure dropping. The patient needed surgery immediately. But when the attending surgeon arrived and pulled back the curtain, everything stopped. Dr. Elizabeth Chen stood there in janitor's scrubs, mop bucket still visible in the hallway behind her. Reed's voice cut through the chaos. "Get her out of here." But then the patient's eyes opened, his hand reached out, and he whispered something that made the entire room go silent. Grid coordinates, Kandahar province, and a date that only 6 people in the world should know. The fluorescent lights of St. Catherine's emergency department hummed their usual 3 a.m. song. Marcus Reed had been the head of emergency medicine for 8 years. He knew every sound, every rhythm, every crisis before it fully formed. Tonight felt different. The ambulance call had come in 12 minutes ago. Gunshot victim, male, late 30s, critical condition. The paramedics' voices had that edge, the one that meant they weren't sure this patient would make it to the hospital alive. Reed was ready. Trauma Bay 1 prepped, surgical team on standby, blood bank notified. What he wasn't ready for was her. Elizabeth Chen pushed through the emergency department doors at exactly 2:16 a.m., not through the ambulance bay. Through the main entrance, she wore janitor's scrubs, navy blue, the name Liz embroidered over the pocket. Her hair was pulled back in a simple ponytail, streaks of gray she'd stopped trying to hide. She carried a mop bucket. Reed barely glanced at her. The hospital employed dozens of cleaning staff. They kept irregular hours, nothing unusual. The ambulance arrived 45 seconds later. Chaos. Controlled chaos, but chaos nonetheless. The patient was a mess. Reed saw it immediately. Gunshot wound to the abdomen, but not clean. The entry wound showed shrapnel patterning, explosive ammunition, or secondary fragmentation, the kind of injury you saw in war zones, not in downtown Philadelphia. "Blood pressure 70/40 and dropping," the paramedic called out. 2 large-bore IVs established. "We've pushed 2 liters. "Get him to Trauma 1, Reed barked. "Where's surgery?" "Dr. Hendricks is 3 minutes out." "We don't have 3 minutes. Page whoever's closest." The trauma team moved like a machine. Cutaway clothing, established central line, cross-match blood, massive transfusion protocol initiated. Reed's hands worked automatically. Years of training, thousands of traumas. He knew this dance, but the patient was deteriorating. Fast. Pressure's dropping. 60/30. He's bleeding into his abdomen. "We need to crack him open now or he's dead." That's when Dr. Hendricks burst through the doors. Christopher Hendricks, chief of trauma surgery, brilliant surgeon, massive ego. He took one look at the patient, and his expression changed. "No," Hendricks said. Reed's head snapped up. "What?" "I said no. I'm not operating on this patient." The trauma bay went silent. Everyone stared. "Chris, what are you talking about? He's got minutes." Hendricks gestured at the monitor. "Look at those injury patterns. Military-grade ammunition, shrapnel consistent with IED fragmentation. You know what this is, Marcus. This is gang violence, drug war spillover. I'm not risking my career on some criminal who'll sue me the moment he wakes up. He's going to die. Then he dies. I've got 3 scheduled surgeries in 6 hours, all paying patients, all insured. I'm not throwing away my morning because some gangbanger got shot in a deal gone bad." Reed felt fury rising in his chest. "You took an oath." "I took an oath to do no harm. Operating on criminals who'll turn around and destroy my reputation does harm. To me, to this hospital, to legitimate patients who need care." "Pressure 50/20, a nurse called out. "Heart rate 180. The patient was dying. Right there. Right then. Reed looked around the trauma bay. 2 residents, both first year. Neither qualified for this kind of surgery. 3 nurses, excellent at their jobs, not surgeons. They had nothing. "Somebody page every surgeon in this hospital," Reed ordered. "I don't care if they're sleeping. Get them here." "Already did," the charge nurse said quietly. "Everybody's either in surgery or too far away." Reed stared at the monitor, watched the numbers fall. He'd lost patients before. You couldn't work emergency medicine without losing people, but losing someone because a surgeon refused to operate? That was new. That was wrong. That was unacceptable. "Somebody, Paige, I can do it." The voice came from the corner of the trauma bay. Everyone turned. Elizabeth Chen stood there, still holding the mop, still wearing janitor's scrubs. For a moment, nobody moved. Then Hendricks laughed, actually laughed. "Security, get this woman out of my ER." "I can save him," Chen said. Her voice was steady, calm, not pleading, stating fact. "Lady, I don't know what kind of TV show you think you're on, but this is a real hospital, with real liability, with real—" "I'm a surgeon." Hendricks stared at her. "You're a janitor." "I'm both." Reed found his voice. "Ma'am, I appreciate the offer, but—" "Grid reference November, Sierra 736452, the patient whispered. Everyone froze. The patient's eyes had opened, barely. His hand reached out, trembling, pointing at Chen. "Kandahar," he breathed. "September 9th, 2011. You were there." Chen's face went white. The patient's hand dropped. His eyes closed again. "Pressure 40/15, the nurse said. "We're losing him." Reed looked at Chen, really looked at her. She stood perfectly still. Her hands weren't shaking. Her breathing was controlled. Her eyes were focused on the patient with an intensity Reed recognized. He'd seen that look before. In surgeons, in soldiers, in people who'd done impossible things under impossible circumstances. "You were military," Reed said. Chen nodded. "Once." "Surgeon?" "Trauma, forward operating base, 3 deployments. Why are you mopping floors?" Her jaw tightened. "Long story." "We don't have time for long stories. Can you save him?" "Yes." One word. No hesitation, no bravado, simple certainty. Hendricks stepped forward. "Marcus, you can't be serious. This woman is a janitor. She has no credentials, no privileges. If something goes wrong, if we do nothing, he dies for sure," Reed snapped. "You want that on your conscience?" "I want my medical license intact." "Then get out." Reed turned to Chen. "You, what do you need?" Chen moved, not rushed, not panicked, smooth, professional. She set down the mop bucket. "Trauma 1, full surgical kit. 10 units O-negative ready to push, massive transfusion protocol, central line, arterial line, ventilator standing by." Her voice had changed, no longer quiet, no longer deferential. Command voice, officer voice. The trauma team looked at Reed. He nodded. "Do it, now." They moved. Chen stripped off the janitor's scrubs. Underneath she wore plain clothes. A nurse threw her surgical scrubs. She changed right there. No modesty, no hesitation, combat efficiency. "I need a surgical team," Chen said as she scrubbed. "I'll assist," Reed said. "I've got surgical training." "Good. I need 2 more hands. You." She pointed at one of the residents. Young woman, looked terrified. "What's your name?" "Dr. Patel." "Patel, your second assist. Your job is to watch and hand me instruments. Can you do that?" Yes." "Don't think. Just do. The moment you hesitate, people die. Understand?" "Yes." Chen finished scrubbing, held up her hands. A nurse gloved her with practiced efficiency. They moved the patient to the OR, 30 seconds. Speed was everything. Chen positioned herself, looked at the surgical field. "Betadine," she said. "We don't have time for a proper prep. This is battlefield protocol." She painted the abdomen. Fast. Thorough. "Scalpel." The nurse handed it to her. Chen cut. 1 smooth stroke, midline incision, 12 inches, perfect depth, blood welled up, dark, venous. Suction. Reed suctioned. The field cleared. For a moment, Chen's hands moved, fast, precise. She opened the abdomen in layers, muscle, fascia, peritoneum. "Retractors." Patel handed them over. Chen placed them, cranked them open. The abdominal cavity was a nightmare. Blood everywhere. Bowel, liver, spleen, all damaged, all bleeding. A less experienced surgeon would have panicked, would have frozen. Chen went to work. "Lap pads. Pack all 4 quadrants. We need to see where the bleeding's coming from." Her hands moved. Packing, packing, packing. The bleeding slowed. Didn't stop, but slowed. "Okay," Chen said. Her voice was absolutely steady. "Major bleeding is from the liver, grade 4 laceration, possible hepatic vein involvement, secondary bleeding from splenic injury and bowel perforation." Reed stared. She'd assessed the entire surgical field in seconds, made a hierarchy of injuries, prioritized interventions. This wasn't a janitor. This was an artist. "We saved the liver first," Chen continued. "Everything else can wait. Reed, I need you on suction. Don't let me lose visualization. Patel, watch my hands. If I call for something, you put it in my palm in 3 seconds or less." "Yes," Patel whispered. Chen worked. Her hands were incredible. Fast but never rushed, decisive but never reckless. She mobilized the liver, packed around it, isolated the injury. "He's got a posterior liver laceration," she said. "I need to rotate the entire liver to access it. Reed, when I do this, he's going to bleed. A lot. You suction. Don't stop. Don't think. Just clear the field." "Ready." Chen's hands moved. She rotated the liver. Blood flooded the field. Massive, terrifying. Reed suctioned. His hand moved automatically. Years of training kicked in. The field cleared. For a second. Long enough. Chen's fingers worked. She was controlling the bleeding with pressure. Direct pressure. Fingertips on torn vessels. "I need 4-0 proline. 2 sutures. Preloaded." Patel's hands shook. She grabbed the sutures, handed them over. Chen took them without looking, without breaking rhythm. She sewed. Fast. Her fingers tied knots faster than Reed thought possible. Surgical knots, combat knots, the kind you learned when seconds meant life or death. 1 suture, 2 sutures, 3. The bleeding slowed, stopped. "Liver's controlled," Chen said. "Check vitals." "Pressure's 65/40, the anesthesiologist called. "Heart rate 160. He's still critical, but he's stabilizing." "Good. Now we fix the spleen." She moved to the spleen, assessed it, made a decision in seconds. "It's too damaged. We take it out." She dissected. Fast, clean. She ligated vessels with the precision of a jeweler. Every movement economical. Every cut deliberate. The spleen came out. 4 minutes. Start to finish. "Check the bowel," Chen said. Reed helped her run the bowel, checking for perforations. They found 3. Chen repaired them, 1 at a time. Perfect technique, perfect speed. 45 minutes after she made the first incision, Chen stepped back. "Close them up," she said. "Layer by layer, proper technique. We've got time now." She turned to Reed. "I need you to close. I'll talk you through it." "Why? You've done everything else." Chen pulled off her gloves. Her hands were shaking, for the first time, just slightly. "Because I haven't done this in 6 years," she said quietly. "And I'm not sure I can hold it together much longer." Reed looked at her, really looked. Her face was composed, professional, but her eyes told a different story. He nodded. "Okay, I've got this." Chen walked out of the OR, slowly, deliberately. Reed closed, layer by layer. He'd done it hundreds of times, but never after watching someone work like that, never after watching perfection. The patient stabilized, moved to ICU, critical but alive, against all odds, alive. Reed found Chen in the hallway outside the OR. She sat on the floor, back against the wall, head in her hands, not crying, just sitting, breathing. He sat down next to her. For a long moment, neither spoke. "You're really good," Reed finally said. Chen laughed, hollow. "I used to be better." "I find that hard to believe." She looked at him. "Forward Operating Base, Afghanistan. 2011, we had a bad day. Ambush, IED. 12 casualties in 3 hours. I did 7 surgeries back to back, saved 10 of them." "That's incredible." "2 died," her voice cracked. "2 died because I wasn't fast enough, because I made mistakes, because I was tired and I missed things and they died on my table." Reed said nothing. Let her talk. "One was 19, Chen continued. "Kid from Iowa, first deployment. He called me mom when he was going under. Said I looked like his mom." She stopped, breathed. "I lost him. Hepatic vein injury. Same injury I just fixed. 6 years ago I couldn't save him. He bled out while I was trying to repair it. I wasn't fast enough. I wasn't good enough. You were in a war zone. Doesn't matter. He died. Because I failed. You saved 9 others. Doesn't matter. I remember the 2. Reed understood. Every doctor remembered their losses, the ones who didn't make it, the ones you couldn't save. I came home," Chen said. "Tried to practice, but every time I picked up a scalpel, I saw his face, heard him calling me mom. I froze, in the middle of surgery. Froze. So you quit. So I quit. Lost my license, lost my career, lost everything I'd worked for, ended up here, mopping floors in the hospital where I used to save lives. Why stay? Chen smiled, sad smile. Because I can't leave medicine. Even if I can't practice it, I need to be near it, near the OR, near the patients. It's all I have left. They sat in silence. The patient, Reed finally said. He recognized you. Sergeant Michael Torres. I operated on him in Kandahar. Shrapnel wounds from an IED, similar injuries to tonight. I saved him then. He remembered the grid coordinates of our base. He wanted you specifically. Looks like it. You saved him again. Chen nodded. Maybe that's what I needed, to prove to myself I still could, that I wasn't broken, that I could still do this. Reed stood up, offered his hand. Chen took it, let him pull her up. Come with me, Reed said. Where? To finish this. He led her to the ICU. Torres was there, intubated, sedated but stable. His chart showed improving vitals, good urine output, no signs of ongoing bleeding. Chen stood at the bedside, put her hand on his arm. Thank you, she whispered, for remembering, for giving me another chance. They walked back to the main ER. Dawn was breaking. The overnight shift was ending. Hendricks was there, waiting. His face was red, angry. You, he said, pointing at Chen. You just committed about 15 different felonies, practicing without a license, endangering a patient, violating hospital policy. I'm calling hospital administration. I'm calling the medical board. I'm calling the police. Reed stepped between them. You do that, and I'll tell them how you refuse to operate on a dying patient, how you let your ego and your prejudice almost kill someone, how you abandoned your oath. I have every right to refuse surgery on criminals. He's not a criminal. He's a decorated soldier, Purple Heart, Bronze Star. He was wounded in the line of duty 6 years ago and re-injured tonight in a veteran support group shooting. You didn't even check his history. You just assumed. Hendricks opened his mouth, closed it. Dr. Chen saved his life, Reed continued, with skill and expertise that frankly surpasses yours. She did it without privileges, without backup, without the luxury of refusing. She did it because it was right. She doesn't have a license. Then we fix that. Reed turned to Chen. You said you lost your license. Can you get it back? Chen hesitated. I'd have to petition the medical board, prove I'm fit to practice. It's a long process. How long? Months, maybe a year. What if you had support, recommendations from hospital administration, evidence of successful procedures? It would help, but consider it done. Reed pulled out his phone, started typing. I'm emailing the hospital president right now, requesting an emergency credentialing review. I'm recommending you for attending surgeon privileges in trauma. Marcus, you can't. I can, and I will. This hospital needs surgeons like you. Real surgeons. Not prima donnas who pick and choose which lives matter. He hit send, looked at Hendricks. You might want to start looking for a new hospital, because I'm going to make it my personal mission to ensure everyone knows what happened here tonight. Hendricks stared at him, then at Chen, then back at Reed. Without another word, he turned and walked away. Chen stood there, stunned. You didn't have to do that. Yes, Reed said, I did. The hospital president responded within an hour. Emergency meeting scheduled. Chen's case would be heard. It took 3 months, 3 months of hearings, reviews, psychological evaluations, peer assessments. But at the end of it, Dr. Elizabeth Chen had her license back. She was hired at St. Catherine's as an attending trauma surgeon. Her first official surgery was exactly 4 months after that night in the ER. Another impossible case, another patient everyone said couldn't be saved. Chen saved them. She saved the next one too, and the next. Word spread. The janitor who became a surgeon, the doctor who came back from the edge, the woman who proved that trauma doesn't have to define you. Patients started requesting her specifically. Other surgeons sought her out for consultations. Medical students competed for spots on her service. 2 years later, Chen was named chief of trauma surgery at St. Catherine's. She rebuilt the entire department, changed protocols, implemented trauma systems she'd learned in combat, trained a new generation of surgeons to be fast, decisive, and fearless. Her trauma team became the best in the city, then the best in the state. Lives saved, hundreds of them. Torres recovered fully. returned to his work with veteran support programs. He visited Chen every year on the anniversary of his surgery, brought her coffee, thanked her again. She always told him the same thing. "You saved me first." Hendricks left St. Catherine's 6 months after that night, took a position at a smaller hospital. His reputation never recovered. Reed remained head of emergency medicine. He and Chen worked together seamlessly, saving lives, training doctors, building something bigger than themselves. 5 years after that night, Chen stood in front of a conference room full of medical students, guest lecturer, trauma surgery and resilience. She told them her story, all of it, the successes, the failures, the fall, the climb back. "Medicine is unforgiving," she said. "It demands perfection, but we're human. We fail, we break, we fall apart." She paused, looked at the young faces staring at her. "The question isn't whether you'll fail. You will. The question is what you do after. Do you let it destroy you, or do you let it rebuild you into something stronger?" She smiled. "I was a janitor for 6 years, mopping floors in a hospital where I used to save lives. I thought I was done, finished, broken beyond repair. But sometimes the people who've been broken are the only ones who know how to put things back together." The students applauded. Some of them were crying. After the lecture, a young woman approached, first-year resident, nervous. "Dr. Chen," she said, "I wanted to thank you for your story, for showing us that it's possible to come back from failure." Chen smiled. "What's your name?" "Patel." "Me, Dr. Patel." Chen's eyes widened. "You were there, that night. You assisted." Patel nodded. "I was terrified. I'd never seen anything like that, the way you worked, the way you saved him. It changed everything for me. I specialized in trauma surgery because of you." Chen felt tears in her eyes. "You did well that night. I just handed you instruments. You were steady when it mattered. That's what counts." They stood together, 2 surgeons, different generations, same dedication. Chen looked around the conference room, saw the future, saw hope. She'd lost everything once, career, identity, purpose. But she found it again, in a trauma bay, in an impossible surgery, in a second chance she didn't think she deserved. Sometimes the path forward requires going through the fire. Sometimes you have to lose everything to understand what really matters. Sometimes the people who've fallen the farthest are the ones who can climb the highest. Chen walked out of that conference room knowing one thing for certain. She was exactly where she was supposed to be, doing exactly what she was meant to do, saving lives, teaching others, proving that redemption is always possible, even for those who've forgotten how to believe in themselves. Your past doesn't disqualify you. It prepares you. Dr. Elizabeth Chen spent 6 years believing she was finished, that her failures defined her, that she'd never be a surgeon again. But the skills she learned in combat, the trauma she endured, the losses she carried, they didn't break her. They forged her into someone stronger, someone who could operate under impossible pressure, someone who could save lives others had given up on. We judge people by their circumstances, by their job titles, by their appearances. We forget that the janitor might be a surgeon, that the quiet person in the corner might be the hero we need, that the ones who've been through hell are often the best equipped to pull others out of it. Look around you. The person you're underestimating might be the one who saves you. The story you think you know might be completely wrong. Give people a chance. Give yourself a chance. Because sometimes all it takes is one moment, one crisis, one opportunity to prove that you're more than your worst day, more than your biggest failure, more than anyone ever believed you could be. What do you think? Have you ever underestimated someone who proved you wrong? Or been the person everyone underestimated? Share your story in the comments below. And if this story moved you, hit that subscribe button. We share real stories of courage, redemption, and the incredible things people can do when given a second chance. Share this with someone who needs to hear it today. Because we all deserve the chance to prove ourselves, even when we've stopped believing we can.